Okay.
Mhm. Yeah, it's started now.
Yeah, it's working for me here.
Mhm.
Yeah.
Yeah.
Okay. Ahmed, do you know if Runak will come to this meeting?
I'm not sure, to be honest.
Okay. Okay. So maybe we can start. What do you think?
Sounds
It's
good.
up to you.
Okay.
Mhm.
Okay. So, hello everyone. Welcome to this SALUS Coffee Talks. This is our section of March, and we are really happy to have this section. And today we will have the presentation of Ahmed. I will make the introduction of Ahmed. Ahmed Albandary is a food safety specialist from Saudi Arabia and a current PhD candidate at Bournemouth University. His research examines food safety culture in Saudi Arabia, focusing on optimist bias. He holds a master's degree in food safety management in 2018 from Technological University Dublin in Ireland, where his dissertation examined the effectiveness of software-based HACCP system, Food Check, for managing food safety. Since 2018, Ahmed has worked as a food safety specialist at King Fahd University of Petroleum and Minerals, contributing to the development and implementation of food safety practices within the institution. His research has been published in peer-reviewed journals, including ACTA Scientific Nutritional Health and Foods, covering topics such as software-driven HACCP system and the role of nutrition in supporting high-risk groups during the COVID-19 pandemic. Ahmed's academic and professional work reflects a sustained commitment to advancing food safety management and culture through research and practice. So thank you for coming, Ahmed. We are very
Okay.
happy to have you here today. And now the floor is yours. You can make your presentation. Normally, we have 15 minutes for our presentation and then 10 minutes to make questions and to discuss a little bit about your presentation, about your research. Thank you.
Great. I'm just trying to share the presentation, so just let me know when it
Okay.
appears.
Okay, it's appear like,
Yeah.
now it's
Yes,
good.
I can see that.
Can you see it clearly? Or?
It's good.
Yeah.
Okay. Okay. Hi, everybody. My name is Ahmed Albandary. I'm from Saudi Arabia. I have a master's degree in food safety management from Technological University Dublin, and I work as a food safety specialist at King Fahd University since 2018. And currently, I'm doing my PhD, and my research title is A Study of Food Safety Culture in Saudi Arabia, focusing on optimistic bias. It's very important to implement food safety management system in any food businesses to protect consumer from any foodborne illnesses, as foodborne illnesses is a global health issue. This is particularly significant in Saudi Arabia, where hospitality sector is expanding rapidly under Saudi Vision 2030, which aims to develop the economy and improve hospitality and tourism sector. The number of international tourists is expected to be increased from 30 million to 70 million by 2030, as Saudi Arabia will host big events. For example, to sport, they are going to host Asian Cup and World Cup. However, implementing it's not easy. It's complex, and there are many food safety issues occur even with a high level of food safety attention. For example, the number of foodborne outbreaks increased from almost 400 to over 1,000 in just 3 years. And last year, reported the first botulism case, which caused 1 death and 75 hospitalization. Therefore, it is suggesting having a proper strategy of food safety culture could be a solution for this. To motivate employees implement food safety practices correctly, as it has already proved that in many food safety research, people play a critical role in increasing or decreasing foodborne illnesses. Also in 2017, reported by Rossi et al., food handlers, even with a high level of food safety knowledge, often fail to implement it in workplace environment. So, in 2023, James et al. Suggested the importance of studying human behavior in context of food safety and focusing on cognitive biases, which is error systematic, which lead people to behave irrationality. One of these biases is optimistic bias, which defined as when individuals believe that they are less exposure to risk than others. In simple words, it won't happen to me. So therefore, they are doing less precautions or ignoring some practices which lead to food contamination. So the aim of this research is to critically evaluate the development of food safety culture as a structure for food safety management and hospitality, with a particular focus on optimistic bias to improve food safety management in Saudi Arabia. To better understand how food handlers' decision-making is influenced, we are using this conceptual framework. As you see here at the left, there are 6 indicators of food safety culture identified by Griffith et al. In 2010, which are management system, leadership, communication, commitment, environment, and the last indicator, risk awareness perception and risk-taking behavior. They have already suggested that all of these indicators influence food safety performance. However, we have the gap here in the middle, which is food handler decision-making is influenced by optimistic bias. Further to that, external and internal factors. An example for external factors include habitudes, time pressure, peers, and availability of resources. An example for time pressure, well, does food handler has enough time to wash their hands or no? So they could ignore and wash their hands if they don't have enough time. Or food handlers could ignore and washing their hands because their peers didn't. So that's an example for peers influence. According to internal factors or cognitive biases that interact with optimistic bias include illusion of control, locus of control, overconfidence, and habit. An example for overconfidence, when food handlers working in a place, for example, 1 or 2 years, and nothing wrong happened, so they became overconfident for nothing wrong happened even when they're doing wrong practices. So in this research, to better understand the food handler's decision-making, we are using dual process theory, which suggests there are two systems in thinking, conscious and unconscious. The methodology for this research is a qualitative method, and we are targeting 2 groups, which are before induced experience and after induced experience. Before induced experience, we are targeting Saudi undergraduate hospitality students who are studying here at Bournemouth University. And we are going, as they are more likely to retain in Saudi Arabia and work in food industry, as it has as one of the Saudi vision goals is recruiting 85 of Saudi people in food jobs. In this group, we are going to do in-depth interview and observation to validate the finding. The second group is after industry experience, and we are targeting food handlers who have already worked and have experience more than 6 months. As less than 6 months, it is considered by the law in Saudi Arabia as a trainer. And the second group will be food supervisor who observe Saudi food handlers to triangulate the result. I have already conducted 33 in-depth interview and 27 observation for the before industry experience. And I have already analyzed the interview, and I will show you the primary result in the next slide. So to analyze the interview, I used thematic analysis and in vivo to manage the data, and I created codes to ensure the themes reflect the correct data. And we have found 2 themes, which are risk perception and food safety culture. According to risk perception, there are 3 subheadings theme, which are food handlers' attitudes to food safety, risk awarenesses and knowledge, and optimistic bias, which is the core of this research. The second theme is food safety culture and include national and culture factor, and unexpected theme was religion and belief. And when I say religion and belief, the majority of participants believe that the Saudi or Muslims are less exposure or more hygiene than others due to Islamic technique, which require people to maintain their personal hygiene and washing their hands and face 5 times before doing their prayer every day. So with this factor, it could increase their optimistic bias and lead to food contamination. At the end, we hope this research can contribute in 3 areas: academic, practical, and policy contribution. An academic contribution by developing a blueprint for food safety management, and for the practical by enhancing hospitality program to support Saudi Vision 2030 goals, and by providing strategy to improve food safety culture and reduce food poisoning as policy contribution. And thanks for listening.
Thank you, Ahmed, for your presentation, and congratulations for your research. It's a very nice topic. It's very nice to see your methods and your first results. So thank you so much for sharing with us. So if you have any questions for Ahmed, now it's your time. I don't know if we already have a question. Sophie, please.
Yeah, Ahmed, congratulations on your research. I think it's really exciting, and for me personally, I look forward to learn more as you gather your data. So I'm curious to learn how you're going to evaluate the optimistic bias. So obviously you did the thematic analysis on your interviews and observations. How are you going to compare, maybe quantify the role optimistic bias play in maybe risk perception?
Yeah, I use indirect question in interview to measure their optimistic bias, and this question already used by Decona and Tarosi who focused previous period on optimistic bias. And by comparing the interview with observation, what they did, we can validate the finding if they did the correct or no.
Okay, yeah. Okay, that makes sense. Thank you.
Okay, Lucy?
Hello, thank you for your presentation. It was really, really interesting. I'm really also very interested in to see, how it turns out in terms of your findings. It seems fascinating. I'm interested in, so the results that you've had so far are all from those that have no experience in the industry at the moment. Is that correct?
Sorry?
So the results that you have so far are from those that have not been in the industry yet?
That's correct.
So, what surprised you about their responses, given the fact that they have no experience in the industry? You mentioned one about the cultural aspects, which I thought was interesting as well. But was there anything else that they were participating in terms of their response that surprised you, particularly because of their lack of experience in the industry so far?
Well, yeah, to be honest, the national and cultural factors, they believe Saudi people are more hygiene than other nationality. So this could increase their optimistic bias as well, even for the religion. So most of them was focusing on this area.
Yeah. So could this be a finding that actually takes you in a direction that you didn't expect?
Yes, for the religion. I
Yeah.
could expect the nationality, and it has been approved already in some research, but for the religion, it wasn't expected.
Yeah. So I think that could be an interesting thing to follow through. Particularly where that last slide that you had where you've got your 3 goals that you're wanting to do this for, the goal on the left-hand side of the slide to do with, I can't remember what the wording now, but to do with
You mean
that's
this applies?
set on this
Yeah.
risk, the lens through which risk as perception is based. So develop a blueprint for food safety management by using effective decision making to improve food safety. The religious and cultural aspect could actually have a contribution towards that, couldn't it? I would imagine.
I think so, because it's focusing on effective decision making, this habitual thinking or
And
behavior.
and I think that's quite an important factor that you're picking up there from the research that you're doing so far, and I find that really fascinating. So I definitely encourage you to continue to look at that element of it from what you found so far.
Thank you.
Okay, thank you, Lucy, for the question. We have any other question for Ahmed? Okay, I have a question for you. I don't know if you already reflect on that, but we are assuming that the optimist bias has a negative impact in the behavior of the food handlers, yes? Okay, so have you ever think about how could we change this optimist bias based on interventions or something like that to improve the food safety culture?
Well, yeah, one of the contribution for this research is to understand the disconnect between knowledge and behavior. It could be improve the training program by not focusing just on knowledge, but focusing only to improve some habitual behavior like optimistic bias.
Okay, because it's something very interesting to see, but well, I'm currently working on interventions programs and different methods to change behavior. and maybe we need to make some adjustments in this kind of methods to achieve the change on optimistic bias, because it's something very particular. So if you see this relation between optimistic bias and food safety culture maturity, for example, maybe it's something very interesting to include specifically in this kind of intervention. So very nice. And I'm very curious to see the results of all the research. Congratulations on that.
Thank you.
Okay, other questions for Ahmed? No more questions. Okay, so I guess that we can finish our section today. And thank you so much for everyone that's here. I also would like to say that we still have opportunity for other students or other researchers to present the research, the work in these SALUS Coffee Talks. So if you have any presentation, any research that you would like to make the presentations, or your student, please let us know. And we will make this this scheduling. We already have another presentation for the months of April and May. So it's already confirmed. So we will see you on the section of April. Okay, thank you so much for coming. And just to remember that next Friday, on 4th of April, we will have a meeting with the students. We are preparing these meetings with students, with PG and master students. Sophia already sent an email for SALUS, but I guess that not everyone already have this message. So I will try to send you again this message. So if you have students, or if you know someone that could join us, it will happen on next Friday in the same time of the SALUS Coffee Talks. I will send this email for everyone today again, okay? So thank you so much for coming. We'll see you next month. Bye-bye. See you.
Thank you.
Thank you.
Bye-bye.
Bye.
Have a good Friday. Thank you, Ahmed, for sharing.
Thank you.
Thank you.
My pleasure. Thank you.
Bye.